In November 2014, the Maternal and Child Health Bureau, Division of Healthy Start and Perinatal Services, hosted the 2014 Healthy Start Convention, a new era of Healthy Start, emphasizing quality and planning for success. This is a recording of the welcome and opening remarks featuring Dr. Michael C. Liu, Associate Administrator, Maternal and Child Health, Health Resources and Services Administration, U.S. Department of Health and Human Services.
Our Healthy Start family is now 101 communities strong. We're in 37 states and DC. We will be serving at least 60,000 women and their families each year. So for those of you who are new to Healthy Start, I want to welcome you to the family. For those of you who are returning, I want to welcome you back. We're now one Healthy Start family with one common mission, which is tied to our legislation to improve perinatal health outcomes and reduce racial ethnic disparities by using community-based approaches to service delivery and facilitate access to comprehensive health and social services for women, infants, and their families. Now, to accomplish this mission, we have identified 5 key strategic priorities. These priorities are built on the latest science, on evidence-based approaches, and on recommendations from the field, including recommendations from the Secretary's Advisory Committee on Infant Mortality. But most importantly, these priorities are built on your cumulative work over the past 23 years, on your knowledge and experience of what works and what doesn't, and what's it going to take to move the needle on infant mortality and on perinatal disparities in your communities and for our nation. We've also established benchmarks for these priorities. Now, these benchmarks are not just some abstract aspiration goals. They are the outcomes that we want to move the needle on over the next 4.5 years. So let me just take a moment to talk about these priorities and their benchmark. The first priority is to improve women's health. For more than 2 decades, prenatal care has been the cornerstone of our national strategy for reducing infant mortality. Federal state efforts in the mid-1980s and early 1990s to expand Medicaid coverage for pregnant women led to significant increases in prenatal care, but not significant improvements in birth outcomes. Now, this is not to take anything away from prenatal care. It's necessary, but not sufficient. Most of us now recognize that to improve pregnancy outcomes in the United States, we have to start by improving women's health, and not only during pregnancy, but before pregnancy, between pregnancies, and beyond pregnancy. So the new Healthy Start will have an even greater focus on improving women's health by increasing healthcare access and expanding healthcare coverage, by promoting the use of clinical preventive services, and by improving preconception and interconception health and healthcare. Now, these are the benchmarks in this priority area that we will be working toward over the next 4.5 years. And let me just call out this first benchmark to increase the proportion of Healthy Start participants with health insurance. As Healthy Start grantees, you can play a critical role in connecting women and families in your communities to health insurance. On that front, you will hear more about new efforts for outreach and enrollment later on during this meeting. Now, this is timely as the second open enrollment period began just this past Saturday and runs until February 15th. So whether your clients need to renew their coverage or sign up for the first time, they can visit healthcare.gov, they can call the 24/7 call center, or they can access in-person assistance by going to the Find Local Help part of the website. Many of your clients may qualify for Medicaid or CHIP, And remember, they can apply for Medicaid and CHIP at any time all year long. There's no limited enrollment period for either program. So let's get women and families enrolled, sign up for coverage. Let's make sure that they have access to healthcare not only during pregnancy, but before, between, and beyond. The second priority is to improve service quality. The new Healthy Start will have a greater focus on prevention and health promotion, recognizing that there are still too many missed opportunities for prevention and promotion that can have a real impact on reducing infant mortality, such as smoking cessation, breastfeeding, immunization, safe sleep, and family planning. The new Healthy Start will also raise the bar on quality by using standardized, evidence-based, evidence-informed curricula and interventions, and by strengthening core competency for the entire Healthy Start workforce. And these are the benchmarks for this priority area. Now, take a look at these. These are low-hanging fruits. Over the next year, we will be working with you through GSI to develop standardized curricula, identify effective interventions, and strengthen core competencies. We can move the needle on these benchmarks. Let's get it done for your community. The third priority is to strengthen family resilience, with a greater focus on supporting mental and behavioral health and promote trauma-informed care to address the toxic stress that underlie much of the disparities that we see in perinatal health. The new Healthy Start program will also give greater emphasis to promoting father involvement and supporting parenting, giving expecting and new parents the tools they need to give their children a healthy start. Again, here are the benchmarks in this priority area. And let me call out the ones on fathers, given the central role that fathers can play in pregnancy and parenting. I want to give a special shout out to the National Healthy Start Association, and really many of you in the room who have pioneered some of the best work to date on father involvement. Going forward, fathers cannot be an afterthought. They cannot stay in the background. In the new Healthy Start, fathers need to be front and center if we're going to move the needle on infant mortality and perinatal disparities. The fourth priority is to achieve collective impact. We redesigned Healthy Start so that it can be truly place-based, which means that we're going to be working to improve outcomes not only for clients who walk through our doors, but for the entire community. And let me just say a bit more about collective impact. If we're going to move the needle on infant mortality and perinatal disparities, we cannot keep working in silos. And that's because there are these social determinants that operate across the life course that are the real drivers of perinatal disparities in our nation, such as poverty, housing, education, father absence, and racism. We have to work across sectors, work across silos to achieve collective impact. Now, we know that for a community to achieve the greatest collective impact, 5 conditions must exist. You need a common agenda, a shared measurement system, mutually reinforcing activities, continuous communication, and a backbone organization. These are the benchmarks in this priority area. And again, given the special place that many Healthy Start programs have in your communities, I truly believe that Healthy Start, and especially Level 2 and Level 3 Healthy Start programs, can serve as that backbone organization to quarterback that common agenda, the shared measurement system, the mutually reinforcing activities, the continuous communication in order to achieve the greatest collective impact in the community. And the 5th priority is to improve accountability. Now, accountability is all about measuring and delivering results. We will do so through continuous quality improvement And Level 3 programs will participate in the National COIN to share best practices and mentor Level 2 and Level 1 programs, and you'll hear more about the COIN later on in the program. And we'll do so through benchmarks and through a scientifically rigorous evaluation platform so that we can truly demonstrate the full impact, the return on investment for a Healthy Start. Our communities are counting on us. Our nation is counting on us to deliver on the full promise of Healthy Start. Now, this is a promise that I didn't just read in a book or learn in the classroom. I saw it and lived it like many of you. Now, I know many of you know my story, but for those of you who don't, I was born to immigrant parents who didn't have a college degree. In fact, my mom, she didn't even graduate from high school or even junior high. See, my mom was only 11 when her father died. So as the oldest girl in a poor family, she had to drop out of 5th grade to go work in the factory to help support the family. The first home that I was born into, it's a tiny little apartment on the other side of the tracks in Taipei where a family of 6 was crammed into. No running water, no flush toilet, health insurance. We didn't have health insurance because there weren't such thing as health insurance. So when you get sick, you just never know how much the doctor or the medicine was going to cost. And so my parents did have to make that choice between paying for food or paying for medicine. And at one point, my mom sold her wedding ring to pay for my medicine. So I didn't come from a wealthy family or an educated family. But once we came to America, none of that mattered anymore. And it didn't matter because the American dream says that you don't have to be rich to go to the best schools. And it didn't matter because the American dream says that everyone gets a fair shot, no matter where you're from, or the family you were born into, or the color of your skin. And that my 2 little girls, I know some of you have seen their baby pictures. Sasha's now actually 11, and Avery with the bunny ears is actually 9 years old now. My 2 little girls, the granddaughters of a girl who had to drop out of 5th grade to go work in the factory, can now grow up in a nation where they get to be anything they want to be. That's a true testament to the enduring strength of the American dream. But if my girls can get that chance, why shouldn't every child born in America get the same chance? If my girls can get a fair shot, why shouldn't every child get a fair shot? That's what Healthy Start means to me. It's a promise. It's a promise of a fair shot to reach your fullest potential, no matter where you live, no matter the family you're born into, no matter the color of your skin. And you can't get a fair shot if you don't get a Healthy Start. So that's the promise of Healthy Start. That's the promise that we're going to deliver. And on behalf of HRSA and the Maternal and Child Health Bureau, I want to welcome you to the new Healthy Start family. And together, in partnership with each one and every one of you, I look forward to working with you to give every child a fair shot to deliver on the full promise of Healthy Start for our children, for our families, for our communities, and for our nation. Thank you.
Thank you for listening to the welcome and opening remarks from the 2014 Maternal and Child Health Bureau Healthy Start Convention. For access to the slides and more information on this topic, please visit www.healthystartepic.org.